Hello, my name's Graham Mooney and I'm from the Department of the History of Medicine at Johns Hopkins University. There are 76 million students in the United States from pre-K to universities. And during the COVID pandemic, many states and local authorities are deciding if and when to close schools. But there's very little definitive consensus amongst epidemiologists about the benefits and limitations of school closure. Schools first became a public health concern with the expansion of public education in the 19th century. Historian Richard Meckel has said that once that happened, it became fairly obvious that going to school meant that children were going to contract infectious diseases. We also know that school closures were used during the 1918-19 influenza pandemic. But they were also used before that, whenever there was an outbreak of common infectious childhood diseases, such as scarlet fever, diphtheria, and measles. There wasn't much consensus about the effectiveness of school closures back then either. But in some senses that didn't matter, because whenever a teacher gave the public health authorities the name and address of a sick child, they could use their statutory powers to enter that child's home and intervene in the lives of the whole household. The history in these readings shows us that using schools for epidemiological surveillance can involve the extension of public health authority in people's lives in ways that go far beyond disease control itself.